This Pitch Breakfast video is brought to you by Spangler and Agans.
I'm Larry Hodges, co-founder of Recovr. Recovr designs and implements physical rehabilitation games and patient assessment tools that improve outcomes and reduce costs for rehabilitation therapy. Currently, our focus is on stroke rehabilitation. Approximately 800,000 Americans suffer a stroke each year. 75% of those stroke survivors have very limited use of their arm. Only about 15% of those people recover use of their arm. And the problem has to do with current therapy. They don't get enough therapy, and the therapy they get is not customizable to their level of impairment. Our initial product is Duck, Duck, Punch. It's a stroke rehabilitation game that addresses these needs. When you play Duck, Duck, Punch, it takes you through the exact motions that you need to do to begin to recover arm movement. Also, the Duck, Duck, Punch is configurable by the therapist so that it actually is appropriate for a wide range of disability. And one of the important things is people like playing Duck, Duck, Punch. When you send the game home with someone, they actually play the game and they do their therapy homework, which is another problem we have with actually recovery. People don't do their homework. Studies conducted at the Medical University of South Carolina indicate that patients that play Duck, Duck, Punch daily for just 1 week had significant improvement in elbow extension, in shoulder rotation, and in motor control of their arm. Our model is to actually provide full service systems to hospitals where we provide hardware, software, clinical training, and technical support, to have low-cost games that you can download for use at home, and then we provide a portal so your therapist can monitor your at-home play. We're currently raising a seed round of $250,000. My name is Larry Hodges from Recovr. I'd be glad to talk to anyone after breakfast. Thank you very much.
Go, Larry.
Yeah. 3 seconds. Great job, Larry. Yes.
Larry, I would like a fuller explanation of how to play Duck, Duck, Punch.
Okay. Now, often, in 2 minutes, I didn't have time for a demo.
Totally, yeah.
But it's, there are a couple things I like to say about the game. One, we've been developing this for over 3 years at the Medical University of South Carolina. So the point is to make a game that what you see on the screen and what you do all has to do with therapy and recovery. So and also there can't be a lot of instructions, especially for stroke victims, because often they have cognitive issues. So here are the instructions. When a duck pops up, punch it. Okay, we're done. Yeah. And we use a Connect tracker, so there's nothing attached to the patient. It's essentially a camera that tracks your moves. And so when you move your impaired arm, there's a virtual arm on the screen that moves, and the therapist controls where the ducks pop up, and they also control things, which is very important in therapy. If you have just a little bit of arm movement, we actually scale the virtual arm, so if you can move your arm a little bit, you can play the game.
Nice.
As you improve, we change the scaling so you continue to improve.
So do I get this game from a therapist, or can I get it for myself, or how does that work?
Okay, so currently the model is that we want to keep connected to your therapist. So the model would be that you go into a stroke rehab gym, they have Duck, Duck, Punch, you play it, and then your homework exercise is actually the therapist says, I want you to take Duck, Duck, Punch, download a copy, you can play it on your computer with a Connect that works with your computer, and do these exercises. I'll set them up for you over the internet. The real problem with stroke rehabilitation, which in some sense a very simple thing, basic stroke rehab, and the main thing we're competing with is a repetitive arm movement practice. Essentially reaching out and grabbing a Coke can over and over because you're trying to get the elbow extension back and the shoulder extension back. And that's basically what they do. Well, that's pretty boring, and you get maybe 30 to 40 repetitions in a therapy session. The research says you need 300 to 600 a day. So you get a lot more repetitions if you're playing the game, and if you take the game home and play it, you come close. We've done at-home studies with the Medical University of South Carolina and St. Francis Hospital. They're doing roughly 500 repetitions a day, every day when we send the game home with them.
That's great.
So you sell the games to patients directly.
Mm-hmm.
How much do these games cost?
Our current model is $299 to download the game.
$299.
$299. For hospitals, we're charging a recurring fee every month that includes many games, We roll in the complete hardware, fancier hardware and software set up. It includes the portal that essentially the hospital is paying for, that the patient can actually, the data is uploaded automatically to, so the therapist can actually monitor what's happening at home. So this is a way to send the patients home to see that they get a lot more practice, because now what goes home with them? A piece of paper that says, go do this.
Right.
That's the main thing. Yeah.
So your pitch made a lot of sense to me, and it was interesting and raised interesting questions, which is the whole point of a 2-minute pitch.
Right.
But 2 questions that I would have that maybe you could have integrated into the pitch. I don't know if there's enough time.
I had 3 extra seconds.
It would have been tough.
You wasted 3 seconds, Larry. Come on.
One is, I mean, this is always the question I have in every single pitch, and it's the only thing that really interests me. How big or how interesting is this as a business opportunity? And I don't know that yet from your pitch. And if sometimes if you don't provide a hint of this is a big opportunity, business opportunity, you don't get the investor interested in asking you that follow-up, interested in having that cup of coffee or follow-up conversation. So to me, I would think from the few things that you said, $2.99 a game, I don't know that this is a big enough opportunity. So it would be great to get that from you. And then the other question I have is competition. Because I've seen other therapy-based computerized games, and you're competing with free. So how does competition come in play, and what is your market?
Okay, you asked me several questions. See if I can hit them all at a time. One, just rehab therapy for stroke is a $17.7 billion with a B market. The total cost of stroke is about $70 billion a year. Our primary competition, there are 2 levels of competition.
But that's not your market.
Yeah, that's not.
To claim that as your market, I wouldn't even try that.
Yeah.
Because it wouldn't be realistic.
And I actually have the spreadsheet projections, but in terms of competition, the primary competition is reaching for your Coke can. And there are several other, well, not several, 2 or 3 other startup companies that are also doing something similar to this. Probably the most advanced one is Gentronics, which actually started in Canada, and it also has an outpost in, I believe, Washington on the West Coast. They're more broadly focused on rehab and not specifically stroke rehab. So we're trying to focus on that as sort of where we pitch our tent to begin with. Although every time we pitch this to therapists, they immediately suggest lots of other things that they could use Duck Duck Punch for. And it's the question about, well, I could go buy a game. Yeah. So if you wanted to improve your GOS score or improve your cholesterol count, could you go down the street and buy a game? No, it's not designed for that. Our games, we spent 3 years designing a game specific to stroke rehab. Even what you see on the screen comes from research that says seeing this as you make the movement helps you reprogram the brain to make the movement. Because it's not a muscle problem, it's a brain problem. Essentially, we're doing a cognitive rehab for you on this. So the fact that our game is very specific to it, and we're going to put most of our care and feeding into the support for the hospitals, and the hospitals essentially become a conduit that essentially sells systems to individual stroke survivors.
So how many, just to follow up on that, to just get a better sense, how many people, thank you, I like that.
Give it a mic, maybe I'll make him my vice president.
How many people suffer, are treated for stroke rehab every year?
There are, how many are, okay, so I give you local numbers. Carolina Healthcare has 1,000 stroke rehab patients right now. Health South has over 100 locations that do stroke rehab. So there are roughly 7 million people that have strokes living in the U.S. and just under 800,000 people that have strokes every year in the U.S. You're living in the middle of the stroke belt if you're in North or South Carolina. We're the belt buckle of the stroke belt, so this is the area that has the greatest need. All that barbecue is my theory. I don't know.
You die happy at least.
You should die happy.
So Larry, I like a lot about what you're doing. I would say 2 things to you. One is, if you're going to raise that amount of money for a product like this in a market like this, I have a strong suspicion that your lead investor is going to be a successful person who's literate in this space. It's going to be a stroke doctor.
I think that's very good.
I think like for you, if you're going to go out to try and raise this money, I would go find that person to lead the round first before I ever wasted any time on professional people, like professional investors. Because I think professional investors are just going to say, market size, too early, right? Whereas a stroke doctor who gets what you're doing, who has the money, will say, I understand what you're talking about, and they'll be able to put themselves in the investment in a way that professionals won't. And the other thing I would advocate to you, and I want to let the audience ask some questions, is I would say go Google stroke rehab and find everybody who shows up organically in those results and identify the ones who could be partners. Because like nobody searches for stroke rehab before they need it, right? I mean, I've never searched for it, but I probably will. I learned that I live in the stroke belt. But when I need it, I'm going to be like, I know absolutely nothing, right? And if you can have a partner who's got real SEO juice already in that space, that would be an asset to you.
And if that guy's sitting in the audience, I'd love to talk to him.
Well, they're on Google, dude. We can find them after. I'll show
Yes,
you.
yeah.
Okay, so what do you want to say?
One, yeah, kind of to the earlier point about finding a bucket of money that exists. Will insurance companies reimburse the cost of the software?
Good question. So there are actually two different answers. The first answer is that if it's done in a stroke rehab clinic by a licensed occupational therapist, absolutely, because all the numbers say this therapy was conducted by a licensed therapist. So we're good there going into hospitals. If it's sent home, we still have some groundwork to do to make sure that's covered by insurance. And one reason we're trying to keep the cost per patient for systems to go home low is there's some number of people that pay for this. People have told us they would pay any amount of money for something that would help them. And every time I talk to someone about this, they say, I have a relative, a friend, an acquaintance who had a stroke. It's a very, people immediately connect to it. So immediately into the hospitals, yes. At home, people might have to pay. That's part of our plan for the next year is to work on that.
Larry Hodges, ladies.
It was good, Larry.
Thank you very much.
Good luck, man.